Antimicrobial resistance, or AMR, is a silent pandemic that is often overlooked. It's, well, a major threat to global health, affecting millions of people around the world. Microbes, including bacteria, viruses, and fungi, evolve over time, adapting to their environments. They can become resistant to the medicines we use to treat them, rendering standard treatments ineffective. This makes infections harder to treat, leading to more severe health outcomes. It can lead to longer hospital stays, higher medical costs, and increased mortality, putting a strain on healthcare resources. AMR develops when microorganisms are repeatedly exposed to antimicrobials, which can happen in various settings. This exposure can be unnecessary or inappropriate, such as when antibiotics are prescribed for viral infections. Overuse and misuse of these medications are key drivers of resistance, making it crucial to use them responsibly. As microbes become resistant, our arsenal of effective treatments shrinks, leaving fewer options for combating infections. This poses a significant challenge to healthcare systems worldwide, requiring global cooperation and innovative solutions to address the crisis. Infection Prevention and Control, or IPC, is crucial in the fight against AMR. IPC measures aim to prevent the spread of infections in healthcare settings. Effective IPC practices reduce the need for antimicrobials in the first place. This, in turn, helps to slow the development and spread of resistance. IPC is a multifaceted approach. It involves hand hygiene, personal protective equipment use, safe injection practices, and environmental cleaning. It also includes surveillance for resistant organisms. Every healthcare worker plays a crucial role in upholding these practices. Hand hygiene is the single most effective way to prevent the spread of infections. This includes hand washing with soap and water. It also includes using alcohol-based hand rubs. Hands should be cleaned at key moments. These moments include before and after patient contact. Negligence in hand hygiene can have serious consequences. Hands can become contaminated with resistant organisms. These organisms can then be easily spread to patients, surfaces, and equipment. This can lead to outbreaks of difficult-to-treat infections. Personal protective equipment, or PPE, acts as a barrier to prevent the transmission of infectious agents. The type of PPE used depends on the situation. Gloves, gowns, masks, and respirators are all examples of PPE. Proper use, donning, and doffing of PPE are essential for effectiveness. Failure to use PPE appropriately increases the risk of spreading resistant pathogens. This includes both healthcare worker-to-patient transmission and vice versa. Breaches in PPE protocols can lead to outbreaks. They can also contribute to the spread of AMR. Section 5. Safe injections and infusions. Preventing bloodstream infections. Ensuring the safety of injections and infusions is critical in preventing bloodstream infections. Unsafe injection practices are a major contributor to the spread of blood-borne infections, including those caused by resistant organisms. Contaminated equipment can introduce harmful pathogens directly into the bloodstream. Reusing needles or syringes, even on the same patient, is unacceptable. This practice can lead to cross-contamination and severe health risks. Safe injection practices include using sterile equipment for each injection. Always ensure that the equipment is sealed and has not been tampered with. Each injection should be performed with a new sterile needle and syringe. This minimizes the risk of infection and ensures patient safety. Proper disposal of sharps is crucial. Used needles should be placed in designated sharps containers to prevent accidental injuries and contamination. Failure to follow these practices can lead to serious infections. Patients can develop complications that require extensive medical treatment. These infections can be challenging to treat, especially if caused by resistant organisms. Early detection and proper medical intervention are essential for effective treatment. Section 6. Linen management. Preventing cross-contamination. Linen, such as bed sheets and gowns, can become contaminated with resistant microorganisms. Proper handling and laundering of linen are crucial. Soiled linen should be handled with gloves. It should be placed in designated bags for transport. Clean linen should be stored separately to prevent contamination. Inadequate linen management can lead to the spread of resistant organisms. This can contribute to outbreaks of healthcare-associated infections. Section 7. Environmental cleaning. Eliminating reservoirs of infection. The healthcare environment can harbor resistant microorganisms. Regular and thorough cleaning and disinfection of surfaces and equipment are essential. This includes frequently touched surfaces like bed rails, doorknobs, and medical equipment. Different surfaces may require different cleaning products and procedures. Failure to maintain a clean healthcare environment contributes to the spread of resistant organisms. This can lead to infections that are difficult to treat. Section 8. Surveillance, tracking, and responding to resistance threats. Surveillance involves tracking the occurrence of resistant organisms in healthcare settings. It helps to identify trends and patterns of resistance. This information is crucial for implementing targeted IPC measures. Surveillance data guides antibiotic stewardship programs. It helps to ensure that antibiotics are used appropriately. Early detection of resistance outbreaks can prevent their spread. This proactive approach is essential for combating AMR. Section 9. Waste management, containing the spread of resistant organisms. Medical waste can be contaminated with resistant organisms. Proper waste segregation, handling, and disposal are vital. Different categories of waste require specific disposal methods. Failure to manage waste properly can lead to the release of resistant organisms into the environment. This poses a risk to public health. It can contribute to the spread of antimicrobial resistance beyond healthcare settings. Section 10. Central Sterile Services Department. Ensuring sterility, combating resistance. The Central Sterile Services Department, or CSSD, plays a crucial role in preventing surgical site infections, also known as SSIs. CSSD ensures the sterility of surgical instruments and equipment. They follow strict protocols for cleaning, disinfection, and sterilization. Breaches in CSSD protocols can have serious consequences. Contaminated instruments can introduce resistant organisms into surgical sites. This can lead to SSIs that are difficult to treat. Section 11. The vicious cycle. Hospital, acquired infections and antimicrobial resistance. Hospital-acquired infections, or HAIs, are infections that patients acquire while receiving care in a healthcare setting. HAIs are a significant concern. They contribute to increased morbidity, mortality, and healthcare costs. Antimicrobial resistance, or AMR, contributes to the development of HAIs. HAIs, in turn, drive the selection and spread of resistant organisms. The overprescription of antibiotics to treat HAIs fuels the cycle of resistance. Breaking this vicious cycle requires a multi-pronged approach. Section 12. A call to action. Strengthening IPC practices to combat AMR. Combating AMR, or antimicrobial resistance, requires a multifaceted approach that involves every level of the healthcare system. Strengthening infection prevention and control, or IPC practices, is a critical component of this effort. These practices help to prevent the spread of infections and protect both patients and healthcare workers. Healthcare workers must be vigilant in adhering to IPC guidelines. This includes proper hand hygiene, the use of personal protective equipment, safe injection practices, and thorough environmental cleaning. Each of these steps plays a vital role in reducing the risk of infection. Surveillance for resistant organisms is essential. By identifying and tracking these organisms, we can better understand and combat their spread. Antimicrobial stewardship programs are crucial. These programs ensure that antibiotics are used appropriately and only when necessary. Public awareness and education are also important. Educating the public about the dangers of AMR and the importance of proper antibiotic use can help reduce misuse. By working together, healthcare professionals can slow the spread of AMR. We can preserve the effectiveness of these life-saving medications for future generations.